Hi, Liz. So nice to see you again. You and I had a conversation a couple of months ago, and you told me about your journey. And I am so grateful that you are willing to share your journey now with the world. So thank you so much for being here. To get started, you were diagnosed with stage 4 lung cancer. Can you tell us a little bit about that diagnosis, and about your journey and when you were actually diagnosed as well?
Yeah, thanks, Cindy. Thanks for inviting me to share my stories. So historically, I'd always been fairly sort of fit and well, never had any sort of major medical sort of issues, no history of cancer in immediate family, an uncle that had been diagnosed with bowel cancer, but that was about it. And in late August, early September 2020, so during the pandemic, I sort of went into hospital with suspected kidney infection, and they ran some tests and discovered that actually there was a rather large and advanced tumor on my right lung. So in September 2020, I was diagnosed with stage 4 non-small cell lung cancer. It had metastasized, so there was a little bit on my left lung and in my neck and stomach. I went into complete shock, if I'm honest, because it was not what I was expecting. Who does? And I was given 4 rounds of carboplatin chemotherapy in the autumn of 2020. And at the same time, I started on a ketogenic diet. I would fast for 4 days whilst having my chemotherapy, and my husband, who started doing some research following his own cancer diagnosis some years previously, introduced me to Nasha Winters and her fantastic book on the metabolic approach to cancer, which I devoured. So I started to respond to the chemotherapy, but not enough. And my oncologist suggested that I had a Guardant 360 blood biopsy done, just to see whether I was one of the very few number of people that had a particular mutation for which there was a drug available. So it turns out I had the mutation. It wasn't licensed in the UK, but my oncologist was able to agree with the manufacturer that I could have access to the drug, given how dire things were sort of looking, really. I did a number of things in the spring, summer of 2021. I was doing mistletoe therapy. I was doing medicinal mushrooms. I had some functional medicine tests done just to understand a little bit about what was going on for me in terms of my immune system, and also what I was genetically predisposed to. I bought a hyperbaric oxygen chamber, which I had installed at home, and I was fasting. I was doing intermittent fasting every day, and I would fast not only when I was doing chemotherapy, but would fast for about 3 days a month. So I had lots of things going on in 2021. Things were getting better, and then things began to, and the cancer then began to sort of fight back a little bit. By autumn 21, my oncologist said, look, now's the time to start taking the targeted drug. So I stopped everything else. I started on the drug, and by December 21, so a few weeks later, I was already beginning to see a sort of a partial metabolic response to that drug. A PET scan in the December of 21 picked up that there was also some uptake in the left breast, and in February 22, I got diagnosed with breast cancer as well. Curable, sort of a grade 1. So I started on letrozole, which is a drug for women who are postmenopausal. I started on that in the April 22. By the summer of 2022, I was struggling with the toxicity of it, so I stopped. continue doing all the ketogenic, continue doing the fasting as well. And by the following year, by the July, August of 2023, a routine mammogram showed that there was no evidence of any disease in the breast. The lung cancer has responded really well to the targeted drug. I've got sort of stable appearances. There's sort of no evidence of any sort of active disease at the present minute, although it's there.
Yeah.
And so, yeah, I mean, there's two cancers, essentially. One that I'm fairly certain alternative therapies have helped to get rid of in terms of breast cancer, and the lung cancer is in a much better shape than what it was 3.5 years ago.
Yeah. And that combination kind of the metabolic therapies as well as the targeted therapy. Now, is that targeted therapy, is that a chemotherapy?
It's, I'm probably going to get this completely wrong. I think it's a kinase inhibitor.
Yeah, kinase inhibitor. Yep.
Yeah. So tablet form. So, you know, I take that every day.
Yeah.
So, yeah.
And typically, so just from a statistics perspective, for those who are not aware or who are not dealing with lung cancer, typically the survival rate for your type of cancer with stage 4 metastatic is between 3 to 6%. So congratulations, you have surpassed that. You're here, we're talking to you, so that's amazing. And also typically radiation and immunotherapy are often part of the treatment for stage 4 metastatic lung cancer. Was that an option that was brought to you? Had you explored those options?
So it really was a case of chemotherapy. So not radiotherapy, not surgery. That wasn't, those weren't options.
Yeah, once it's already spread like that. Yeah. And so then the 4 rounds of the chemotherapy in 2020, has chemotherapy been an option since, or were you supposed to do more rounds, or was that the initial rounds discussed?
Yeah, no, those were the initial sort of 4 rounds. The recommendation from my oncologist was then to sort of take the targeted drug. We have discussed frequently, well, what happens if that stops working? What options do I then have? And my understanding is that there would be a much stronger form of sort of chemotherapy, quite an aggressive form of chemotherapy. So I'm kind of keen to do anything within my gift to avoid that eventuality. But as I say, so far, the targeted drug seems to be holding it in check, having, you know, reduced it significantly from where it was.
Well, it's a really beautiful story of that integrative approach, right? And how you can use the best that standard of care has to offer in terms of pharmaceuticals and therapies and drugs, and then also combining that with the metabolic approach to be able to support handling the therapy, the targeted therapy so well. So can you talk a little bit about that? And can you tell like what's effective and what's not effective?
Yeah, it's interesting. So when I got diagnosed, I knew from my husband's experience with cancer and his own sort of research that I needed to not just rely on sort of Western medicine to do everything in terms of, you know, beating the cancer. I needed to sort of own my own diagnosis.
Yeah.
So I did almost straight away. I mean, they told me on the Thursday, I think by the Saturday I was home and I started ketogenic diet. You know, that was just let's not mess, let's get on with this. I also started fasting as well. So not just intermittent fasting, but when I was having chemo, I would be doing sort of 4 days water only
Oh,
fasting. And that really helped with reducing some of the side effects. I didn't feel quite so nauseous. I didn't have, some of the digestive problems that you can find sometimes with chemotherapy. So that really sort of helped. And I
what about,
still
what about your hair? Did you keep your hair?
yes, it was quite a mild form of chemotherapy. It's a platinum-based chemotherapy. But yeah, no, I kept my hair. And I started looking at, well, what else could I do? And that was where sort of in Nasha's book, where she talks about, doing the train 10, understanding some of those big areas where you need to sort of focus a lot of change, and then looking at, okay, well, what does she recommend around things that you could do to help? I did mistletoe therapy. I did medicinal mushrooms. I
Mm.
got some functional medicine tests done just to understand how I could help bring my immune system sort of back into balance to help fight the cancer. And so as a consequence, I had some very targeted and very specialized supplementation that I was sort of taking as well. And that for me was kind of dealt with, what I was consuming. Other parts that I wanted to work on were sort of activity, so exercise. How can I reduce stress as well? Because a cancer diagnosis can be quite stressful, right? So I was building my garden at the same time as going through chemotherapy. So I was laying paving slabs, putting up fencing, painting, digging, putting in electrics, water, anything that got me out in the fresh air. I would walk for an hour or two a day, often in the rain and the wind, just to feel. I think in Nasha's book, she talks about facing the elements. And the windier it was, and the more rain there was, the better it was, and the better I felt, I suppose.
And really good for your lungs as well, right? Get the lungs and that good just outdoor fresh air and oxygen and nitric oxide as you're moving and exercising. Really, really good for the lungs.
Absolutely. And one of the other things I did was I bought a hyperbaric oxygen chamber. So I started doing that as well during 2021. And whether, I mean, it certainly helped the wrinkles. I mean, I don't know whether it helped with the cancer, but definitely, I think, sort of looking back, that combination of targeted drug, looking at what I'm eating, so keeping the sugar to absolute minimum,
Yeah.
doing what I could to avoid stress, and certainly exercise helped. I suppose the thing with everything that I was doing, it was the sort of the Western medicine in conjunction with reducing sugar. So doing the ketogenic diet and also measuring my ketones as well.
Yeah.
And also mixing that with exercise and reducing stress. So, not just about reducing the stress through exercise, but also in terms of how I was thinking about the cancer and what I was thinking as well. So what I was thinking, how I was thinking to keep those emotions in check and kind of just deal with what do I know to be true that day, and not worry too much about what might be coming, not worry too much about the labels that needed to be put on me so that the medical world could treat me in the most appropriate way. And I think those things are probably some of the big levers to be had, along with fasting, which I absolutely love and couldn't advocate more.
Yeah. And yeah, in your written testimonial, you had said you avoid anything that causes you stress, including thinking about cancer.
Yeah,
Yeah.
absolutely.
Yeah. that's a big stress that can put you in fight or flight as well. And who was supporting you kind of in both of these approaches? So you had a doctor, you're in the UK, so you had a doctor through NHS, which is the Western medicine system. And then did you also have a doctor or practitioner or somebody that was helping to guide you on the metabolic side in terms of ketogenic, mistletoe?
So you're absolutely right. I had my lung oncologist, and when I got diagnosed with the breast cancer, I had a breast surgeon as well. And it was important to make sure both of them were talking to each other, and they worked at the same hospital. So this is again through the NHS. I listened to a cancer conference, and that's where I came across integrative medicine in London, a small clinic there where I sought my mistletoe therapy from. I, through the same cancer conference, got to learn of a chap called Mark Bennett, who does functional medicine. And he was saying, look, you need to understand what's kind of going on for you, because yes, you could have somebody else with, the same type of cancer with you, could be the same age, same gender, but you need to understand you. So I sought his services in terms of those tests, and to get his advice on what he thought also could be really good levers to sort of pull on. So really it was those 4 groups, if you like, that I was sort of in contact with sort of most frequently.
And did your lung oncologist and breast oncologist or surgeon support you in kind of fasting and ketogenic and mistletoe? Did you have those conversations with them?
Yes, I did. And I think it's very interesting, the mindset that you kind of come up against sometimes. For me, my lung oncologist is, I find, quite a sort of open-minded consultant. And we certainly talked about Thomas Seyfried and sort of Walter Longo's work with him before I started doing, sort of certain sort of therapies, because I wanted to make sure that I wasn't doing anything that was going to actually cause more harm in the long term. So I did speak to him, and I did share my functional medicine tests as well with him. So yeah, I became a sort of, if you like, a sort of a conduit from, practitioners to sort of explore with my oncologist, what do you think? Is this going to be a problem? Is it a good idea? And actually, he was incredibly receptive, and continues to be, and is I've got a lot of time and respect for him.
Yeah, oh, that's amazing. That's amazing. And in one of the things that often comes up with individuals in the UK is the fact that there's out of cost expenses associated with metabolic therapies, and often the functional tests. Did you experience that as well?
Yeah, absolutely. Yeah, I mean, functional medicine tests are privately paid for, and you have the NHS where that is, health provided at the point of need, paid for by the government, paid for out of taxes that we pay for as UK citizens. Then you have the sort of private medical sort of sector. So I'm fortunate enough to have private medical paid for by my employer.
Oh, nice.
They wouldn't pay for functional medicine tests. I had to pay for those tests, and for the mistletoe, and for the blood biopsy, myself. So yeah, no, it's not something that's something that you get for free over here. You have to dig deep. Worth it.
just a kind of an unfortunate part of where we all stand. And I would say that it's regardless of what country you are in. In the US, often people think, well, we already pay for our insurance, but our insurance does not cover the functional medicine tests, as well as, liquid biopsies, and then all of the different therapies. We have to pay out of pocket for that as well. In addition to the hefty prices that we pay for insurance. And I think we pay our insurance out of on a monthly basis, and we can see it. You pay it on a monthly basis out of your taxes, whether you see it or understand the costs of that or not. But it can be heavily driven by, just having to pay those additional costs, which is just really unfortunate.
Yeah, no, there's definitely I guess I'm fortunate. I'm fortunate that I've got a husband who, goes and just sort of checks out and researches things. I'm fortunate that we've got the financial means to be able to, sort of pay for this, pay for the functional medicine, to pay for the mistletoe and the mushrooms. And it's not cheap. It really isn't cheap. The hyperbaric oxygen chamber, it's a lot of money to buy. And it's a shame, really, because I do sometimes wonder if there was the opportunity to do more functional medicine tests to be able to, for people to understand what's going on for them, whether actually we'd end up preventing more sort of illnesses and diseases, and rather than having to sort of deal with the consequences or indeed the symptoms.
Yeah, absolutely. That's one of our missions, is to make the metabolic approach and these tests and these therapies more accessible. And so lots of fundraising activities and things of that nature, so that we can give away more patient grants, because it's hard, but in order to understand why our body is doing what it's doing and how we can manage it. And that's kind of a good point, is it sounds like that's where you are today, is you are managing this disease, and you're managing your cancer more of an ongoing basis, rather than, just trying to do everything you can just to destroy it quickly.
Yeah, I think to begin with, there was you're in a burning building. You feel like you're in a burning building, and you do whatever it takes to get out of that burning building. And if somebody said to me, well, if you cut off your right arm, you'll have no cancer, you'd have thought, well, do you know what? I've got a left arm. I can cope with that. I don't, cope with that. And there is this sort of tendency, I found a tendency to sort of panic and kind of go, gosh, I need to try everything, do everything. I need to, have my, half teaspoon of turmeric every day. And if I don't, oh my goodness, what's going to happen? And you worry and so forth. And I think now it is just the living with cancer. And I don't know how long, that will be for. It's a new drug that I'm on. There just isn't the data. But I feel, having come this far and having made so many changes in my life, that I feel a bit more sort of comfortable with sort of leaning back on some of those alternative therapies. That makes me feel a bit more knowledgeable, and I feel more confident that if the drug were to stop working, I would go, right, okay, let's do an awful lot more fasting, or let's really going full out on making sure that immune system is working as well as it possibly can be. So
Yeah. I mean, you're working them in parallel paths. The challenge that we often face is, we're using these targeted therapies to push the cancer back, but we're not working on the metabolic function in the environment. And so when the drugs do stop working, which, they often do, that's not uncommon, which is why we have to switch. We don't have the metabolic health and the metabolic support, so things can progress quickly, but you're doing these in parallel paths. So you're setting yourself up for success. And also, our bodies go into the cancer process because our metabolic function is broken. And so now you're working on your metabolic function, and hopefully your body doesn't want to or your cells don't want to continue to go into this cancering process.
Yeah, it's interesting. I with the terrain 10 and the questions,
Oh yeah.
I ran the test. I did the terrain 10. I was probably after my first round of chemo. So this was about 5 or 6 weeks after diagnosis. And I answered the questions based on what life had been like before diagnosis. So in other words, sort of working full time, slave to the laptop, not much exercise, and because it was the pandemic as well, just eating whatever food was available in the house. And I scored something like 33 yeses across all of the 10 terrains. And now there's some things that you can't really change in terms of your sort of, your history, as it were, or your genes. Yeah. I reran the test a week or so ago, and based on life as it is today, and that 33 had come down to 21.
Wow.
And I could see where there were some significant drops in the number of yeses that there were. Now, there were some things that were about sort of the same. So I know that I still need to do more work on my digestive system, but my stress levels have completely gone, dropped through the floor compared with what they were like before.
Yeah, that is amazing.
I think there is something to be said for, you make the changes, and then you've then got to live with it. And so I think those changes have to be sustainable.
Yeah. Yeah, absolutely. And would you say that your quality of life has changed from before your diagnosis to after your diagnosis?
Hugely. I mean, this will sound slightly perverse, but I feel happier since diagnosis than I did before. Now, I'm incredibly fortunate that I don't need to worry too much about income. Yeah. And that has a huge bearing. But I think I felt more grateful.
Yeah.
I worry less about what's coming up or what I've done in the past. Sometimes I'm just happy to be.
Yeah.
I can go whole days without even thinking about cancer. So it's, yeah, I definitely say I'm a happier person now than I was before.
And do you think that that's attributed to everything, lifestyle changes, diet changes, mental emotional work, or are there, just certain things that, it sounds like one, just taking all the stress off your plate, and not having to continuously, be the hamster on the wheel, chasing.
Yeah, I think it probably is a combination of everything. Definitely, absolutely, definitely. And I wouldn't want to sort of make too many sort of major changes right now. I don't think, if I was to sort of go back to work, I think we'd have to think really long and hard about what I was doing. The exercise side of things. I mean, I've never exercised so much in my life since having cancer. I wouldn't want to change that. So yeah, I definitely think it has to be this combination of what you're eating, what you're consuming, how you're thinking, your exercise as well. It's definitely they all sort of work with each other, so that sort of interdependence. I wouldn't want to sort of take just one thing out and stop doing one of those elements.
Yeah, it sounds like a better balance all the way around. I know that we often get hung up in our careers and needing to be incredibly successful, And we don't realize how much stress that can take on. And then also trying to be super mom and super wife and super everything. And oftentimes we're neglecting ourselves and what our body needs.
Yeah, I think so. And I think there's a sort of a change in how you sort of think as well and what you value. And I think when you get a diagnosis, particularly a shock diagnosis like the one I had, suddenly you kind of sort of fall back down sort of Maslow's hierarchy of needs, and you are worrying about your physiological needs. Are those sort of being met? And then you can sort of build yourself back up again. So, you know, climbing the pole at work, or worrying about whether something was posted on LinkedIn and where people are at and where you are in terms of how, none of it matters. It really, really does not matter in the scheme of things. And once you step away from that, as I had no choice so, but I was sort of pushed through this sort of portal of, you know, diagnosis, you sort of think, well, why did I not have this enlightenment before? Why has it taken this catalyst of cancer for me to sort of step back and go, do you know what? I'm not sure that it was a set of values that was healthy for me.
Right.
And I think it's just that evolution of thinking and value system and beliefs, which are part and parcel of, I think, dealing with stress, is you can sort of step back and see things, see the world slightly more holistically.
Yeah.
And how things are interconnected, and not worry about things quite so much, and think about your interactions with people and where am I getting, you know, is there drama here? Am I getting stressed here? And
Yeah.
I think it's kind of, you know, I go back to, you know, it's what you think and how you think, and those two things together, you know, change as a consequence of cancer, and change how you think about cancer.
Yeah. Well, what would you tell somebody who was newly diagnosed and listening to this video? And I will say that, you know, I think what you often hear, especially with stage 4 metastatic lung cancer, is that it's a death sentence and that people don't survive it. And obviously you're here.
Thank you. Yeah, I mean, I was told to sort of, you know, they're going to buy me sort of more time, so it was pretty devastating. But I think I would say own it. Don't sit back and sort of be done to. Ask questions. I wouldn't look at statistics too much, because, you know, you are unique. You know, it's your DNA, it's your cancer diagnosis, it's your attitude, and you are effectively a statistic of one. I would say do the terrain 10. Absolutely do the terrain 10, because if you're wanting to make changes in your life, then this will help give you a framework on which to identify what changes to make, not just immediately in terms of diagnosis, but going forward. Find a functional medicine practitioner to help you understand what's going on in your body. And if you've got kids, I would encourage your kids to look at the food labels and just check out the sugar content on everything.
Yes. Yes, that's a really good point. I know that you have a daughter. Has this changed for her?
Yeah.
Oh, and the son, yeah.
Yeah, no, so they were 10 and 7 at the point I was diagnosed. So they are now beginning, without being prompted, to sort of look at the backs of packets and kind of work out how many grams of sugar is in something and whether that would be okay. And I'm sure they have a little mum and a little dad sitting on their shoulders when they're wanting to buy something fizzy or sweet, and they immediately put it back down on the shelf and move on.
Yeah.
So
Yeah, that's such a, like moving this forward and paying it forward, to our children, and then who will pass it forward to their grandchildren. It's just a different way of life, and that education, it does get better. And when we change our house, and when we change what we're bringing into our house, it will naturally change their trajectory as well. I think the statistics are that the standard sugar consumption before 1930 was about 7 pounds a year. And since the 1960s, it's been skyrocketing up. And they predict now that it's anywhere in the standard American diet, the SAD diet, that it's anywhere from 70 to 140 pounds per person per year.
Oh,
And then we wonder why we're getting disease.
yeah, yeah, and I do wonder whether in the UK, we come up against teachings in school or in our National Health Service that sort of says, look, you need to have so much carbohydrate on your plate.
Yeah.
And I do wonder where that data, the policy that gets made, where that policy really was sort of drawn from, what sort of set of data, and whether it looked at an awful lot of data or just a subset of the data before sort of making policy. So, I know that my son, for instance, has in science lessons and in sort of, cookery lessons at school, come up against a bit of a brick wall at times in terms of that sort of fixed mindset around teaching and nutrition, where he sort of, turned around and said, well, my mum's got cancer, but she eats a high fat diet and she's fine and doesn't have cholesterol problems.
Right.
And I think there's just something about, we have to question more. We have to question more, and we have to train our kids to question, not just around food, but just everything,
Yeah.
with medicine or what they read or hear on the news. We don't do enough questioning, perhaps.
And this is where we do have to look at the statistics, because if you look at the statistics, since they started publishing the food pyramid, which they now call the food plate, which is written by the USDA and the FDA, they publish a new one every 4 years. And I think too many countries have adopted the US standard American diet. And that since they started publishing that, the rate of disease has skyrocketed across all diseases, obesity, heart disease, cancer, all of these, most of these are metabolic disorders. And it's just skyrocketed. And the more that we continue to change the narrative around the standard of American diet, or the more that they publish new recommendations for that, the more that they're adding carbs, which all convert to glucose. And the more we remove proteins and essential fatty acids and amino acids that our body needs for all of its biological processes.
Yeah, no, for sure. I was in Canada a couple of weeks ago, and it was so refreshing to sort of go into sort of supermarkets there and just see, ketogenic food on the shelves, and see the microgreens, and that's way more advanced and progressive than we know what we sort of see in the UK, unfortunately. Yeah, I mean, we could spend many hours, I think, talking about food policies and standards.
It is definitely a topic that we should all be aware of, and be thinking about what we're putting in on and around our bodies as well. So, well, thank you so much for sharing. Anything else you'd like to add before we wrap up?
No, I think just reflecting on initial sort of diagnosis, and you come across a lot of people sort of peddling their services and their sort of products, and it can feel incredibly overwhelming.
Mm-hmm.
And you don't know which way sometimes to sort of turn, and whether you're doing enough of one thing, and then you sort of worry, oh gosh, if I do that, then I haven't got time to do this over here, and it can be a frightening time because you don't know whether you're doing sort of the right thing. One thing I would say about, cancer is, and what occurred to me quite early on is that it's complex, and as opposed to something that's complicated where if I do A plus B, I'll get C. With cancer, we have to sort of think slightly differently and kind of go, look, okay, between scans, I'm going to try this, and then I will, at the next scan, see whether actually that's had the right sort of effect or not. And you suddenly start to think in a slightly more agile way.
Yeah.
Kind of go, right, okay, well, it's not necessarily about either or, sometimes it's about and, so if I do my targeted drug therapy and I do fasting and I do ketogenic, is that going to give me sort of the results that I sort of want to be sort of looking for? So I firmly believe that we have to think about cancer as being, complex. It's a complex system, and therefore we have to treat it not in a very simplistic way, but in that sense and respond, and we have to kind of pivot depending on the results that we sort of get. So I wish anybody that's just had a diagnosis, stage 4, stage 3, stage 2, whatever it is, it doesn't matter. It's it's cancer, right? You'll find your way. You will find your way, and I wish them the best of luck.
Yeah, thank you for saying that. So well said. Dr. Elsaka, who works for us and is leading our research organization as well as some of our clinical programs, says it's an art, not a science. And when we treat it as A plus B equals C, we lose the art and we're not in tune with our bodies and listening to our bodies. And that sounds like that's exactly what you did. You listened and you learned from your scans and from your labs and from your testing and pivoted. And I'm assuming that is something you will continue to do for a very long time.
Absolutely. And I think, if I was to get back to work, my usually I sort of work in sort of project management, program management, that sort of field where, everything's quite sort of waterfall. You do this and then you do that, you spec it, then you design it, then you build it, and then you test it and so forth. I think having had the cancer, it changes how I keep saying it changes how I think. That would be one example of not just project management, but most things where it's complex, you're dealing with people, dealing with organizations, where I would be thinking about, okay, well, let's try this one small thing, let's measure it, and let's see what outcome we've had with that, and then be prepared to then look at the options that we've got and employ the next one that we think might work, and try that, and then we measure again.
Yes.
It's just sort of those
repeat. Yeah,
absolutely.
Well, I thank you so much. Thank you for sharing your story. Thank you for being brave and taking your cancer into your own hands and not letting it own you. And let us know if there is anything you need. And thank you so much.
No, thank you again, Cindy. Good to see you. Good to speak with you again. And thank you.